You're listening to a brief excerpt from the Creating Value-Based Payment Success in Managed Medicaid Through Analytics webinar, co-sponsored by ChangeHealthcare. In this webinar, Chris Simpkins, Vice President Value-Based Analytics, ChangeHealthcare, shares some of the many ways episode analytics can be used by managed Medicaid plans to drive improved care quality and lower total costs of care. Dr. Andrei Gonzales, Assistant Vice President, VBR Product Management, ChangeHealthcare, provides insights into some of the clinical aspects of episodes of care which are unique to the Medicaid market.
So the topics we're going to cover today are going to be the state of the value-based market in reference to managed Medicaid plans. We're going to address some of the unique challenges when operating in a Medicaid population, and we're also going to discuss some opportunities on how to leverage episode analytics within a Medicaid population. So the first challenge that we see in recruiting providers to a Medicaid value-based program is the lower reimbursement rates paid to providers when they treat Medicaid patients. Medicaid reimbursement rates are below the Medicare rates in all but 2 states, and on average, Medicaid pays 28% less than Medicare. The gap between Medicaid and commercial plans is even larger, with the average commercial plan paying 40 to 50% higher than Medicaid for the same services. This gap does vary by state, but providers have a clear financial incentive to treat commercial patients rather than Medicaid patients. This makes it challenging to convince providers to take on additional financial risk of an upside-downside episode program. This is why when we're working with our clients, we recommend starting a value-based payment program with an upside-only financial incentive and then gradually moving towards an upside-downside program later on.
What I'd like to do is, as Chris said, talk a little bit about the impact of episodes of care on both quality of care and cost of care. So I'd like to review some research that's been done in the industry to show the effect. It correlates very nicely with some of what Chris was talking about in terms of looking at especially chronic care episodes for Medicare members. ChangeHealthcare has done a number of research studies, surveys of payers and providers looking at the transition from fee-for-service to fee-for-value. The results that we've seen over the last 5 years show that the industry has really moved towards value-based care and that the industry has really bought into the potential benefits in terms of both improving cost and improving quality control for patients. We've seen that episodes of care as a model within value-based care have been well adopted. There's no one single model like ACOs or medical homes or episodes of care that are seen as potential solutions for improving cost and quality, but they're all really have their place and they all have a way of functioning very well for different populations and in different locations. We've seen that episodes of care in particular can deliver medical savings as high as 7.5% as reported by health plans. We've seen that respondents in these surveys improve or report improvement in care quality plus improvement in provider relationships. We've seen that commercial lines of business are kind of leading the value-based care program adoption from a commercial health plan perspective, at least in terms of the commercial lines of business versus government lines of business. We've seen that it takes a while to launch these types of programs. They're pretty time intensive, and some of the analysis that Chris was talking about is part of the work that needs to be done as a health plan or a health system is looking at implementing an episode of care program or any value-based care program, really.
You've been listening to a brief excerpt from the Creating Value-Based Payment Success in Managed Medicaid Through Analytics webinar presentation. This webinar was co-sponsored by ChangeHealthcare and recorded on March 14, 2019. The full webinar included discussion from ChangeHealthcare's Chris Simpkins, Vice President Value-Based Analytics, and Dr. Andrei Gonzales, Assistant Vice President VBR Product Management. You'll want to be sure to view a PDF version of this presentation. To do so, go to the link appearing now on your screen.